Good morning, guys. I hope we're all sparkly. To effectively diagnose testosterone deficiency, you need 2 diagnostic blood tests. Why 2, I hear you cry? Well, essentially to demonstrate chronicity. You don't want to rush into the diagnosis of testosterone deficiency, and as I've said numerous times before, testosterone deficiency is a diagnosis of exclusion. So we recommend a comprehensive blood screen as your initial starting point. Now, you can go for a less intensive blood screen, but more information, more power. So what we're going to be doing is identifying what your hormones are doing. Obviously, not just testosterone, other things like thyroid, look at reversible causes, look at contraindications, the list goes on. So I thought what we do today is we go over a blood test, because people are often delighted that I'm saying to them that you could do X, Y, Z and potentially optimize your levels without needing to commit to TRT. So we're not like the other clinics. We're not trying to put you on testosterone replacement therapy. So let's go through a TRT Complete Plus. This guy, mid-50s, of Asian descent. So biochemistry. We looked at kidney function. What do we tend to see here? Well, we tend to see a raise in urea because most people are dehydrated. Now, we say you should measure your levels in a fasted state, so that's nothing to eat, but you should drink plenty of water because you are 70% water, and hydration status is not going to affect your testosterone level, and you should always be hydrated. This is a chronic problem and a problem that most people have. And if you drink a lot of water and you've still got a raised urea, it's likely you're not having enough electrolytes. Again, this is a problem in society. We sometimes see a rise in creatinine, and your GP is going to freak out because that's going to lower your estimated glomerular filtration rate. But if you're a muscular guy, high protein diet, or take creatinine, then it will be artificially elevated. So again, everything has to be taken into context. Now, decreased kidney function can obviously affect your rate of erythropoiesis, because erythropoietin is produced in the kidneys, and that tells the bone marrow to produce red blood cells. Again, obviously, if you've got chronic kidney disease, that's a problem with excreting medications and potentially hormones. So what else? Well, this guy actually had a raised HbA1c. And this is a measure of glucose control over 3 months, glycosylated hemoglobin. So, yeah, number 1, look to address diet. And as I've said numerous times before, we advocate a low carb, high fat diet and retest in 3 months. His vitamin D level was low. Now, again, Asian origin, UK, no chance. We have patients in Marbella who have a vitamin D deficiency. Most people have a vitamin D deficiency. Whenever I see a good, healthy level, I say, are you supplementing? The answer is always yes. So I tend to recommend 4,000 IU of vitamin D3 in the morning, not the evening, because it can wake you up. Now, vitamin D is necessary for testosterone production, which is one of the reasons, obviously, why we test it. But it's also necessary for lots of other physiological things. So don't ignore vitamin D. Liver function test. This is obviously illuminating sometimes. What do we tend to see? We tend to see a raise in ALT in some guys. Now, again, there are numerous causes for that. So we look to gamma GT as the acute inflammatory marker. And if we see those two in conjunction, it's either you're a chunky monkey and got a fatty liver, or you're a bit of a boozer, and you may potentially have non-alcoholic fatty liver disease. So again, it gives you hopefully an incentive to look to address your diet, your stress, your sleep, your exercise, and be healthy. Now, we shouldn't really have to say this, should we? Be healthy. But we should always be working to be more healthy and ignoring the path of least resistance, minimum reward, because it's not long standing, and do what we need to do, not what we want to do. Okay. And then you'll find what you want to do is what you need to do. So lipids. Now, I am not a fan of statins. Why? Well, cholesterol is the precursor to pregnenolone, and that cascades down to all of your steroid hormones, cortisol, aldosterone, and testosterone. And what do we do here? Testosterone replacement therapy. So it's not rocket science as into why we don't like statins. So what we should be doing is to be looking to address the inflammation that has raised the cholesterol. And we often want to optimize the other parameters because it's not about the one isolated quantitative marker, it's about addressing everything. So HDL is normally a problem. So we say omega-3, oily fish to try and raise that up. And again, speaking in generalities, low carb, high fat. But again, nutrition's so personal, it's very hard to advise somebody and speak in such generalities. What else? Hematinics. So essentially the components that help produce the red blood cells. So iron stores. We don't tend to have problems with iron stores. If you do, so if the ferritin's elevated, it's normally a marker of inflammation. But again, it does need to be followed up. B12, we often see a deficit in that. And folate, we often see a deficit in that. So I tend to recommend a good B complex vitamin just to optimize those numbers. Thyroid function. So again, we test TSH, T3 and T4. The thyroid has a relationship with testosterone. It's a bi-directional relationship. And we obviously know about thyroid's relationship with SHBG as well. If you've got hyperthyroidism, we see an elevation in SHBG, and hypothyroidism, we see a low SHBG. Again, a hypometabolic state. And what do we want? A healthy SHBG. Because SHBG is a positive health marker. So the bros want a lower SHBG. We want healthy ratios of everything. So this was all good. Prostate, obviously a major topic right now with King Charles unfortunately being diagnosed with prostate cancer. But this will hopefully raise awareness of the need for monitoring your prostate through blood tests and a digital rectal examination. We have a Facebook group, TRT in the UK, that's not just my patients, it's patients from everywhere. And one of the guys said, well, you can go to this company and you don't have to have a prostate examination if you're over 40. You can get everything done online. You don't even need to see a doctor. Why would you take that risk, that lottery, when you should have a prostate examination and a regular PSA? Now, we don't currently have a screening process for prostate cancer because the test is non-specific. But we show due diligence. So we want to act in your best interest. So personally, I'd prefer to have a false positive and it turn out not to be prostate cancer than just not to bother, to get away with it and then have a horrendous prostate cancer that you're going to die from because you go on TRT. TRT does not increase the chances of prostate cancer. But if you've got a high normal testosterone level where you feel great in, it's going to accelerate the growth of the prostate cancer. So Joseph Hernshaw, my medical researcher, wrote a paper on, or an article on prostate cancer and dispelling the myths. Have a read of that if you're interested. But again, as I said, testosterone does not increase the chances of developing prostate cancer. And we have patients who have had prostate cancer who have had the all clear and the go ahead for TRT after the prostate cancer has been cleared. And they're obviously doing well. So it gets to the nitty gritty. So we'll actually talk about the numbers here, or the reference ranges. So endocrinology, so luteinizing hormone and follicle stimulating hormone. Now, both of these were elevated in this guy. So that would naturally assume that this guy has a primary hypogonadism. But obviously it's a bit more complicated than that. If we look at his estradiol, it's high normal. Now, again, we know the modern testing for this is, again, non-specific. So you have to take everything with a pinch of salt and understand the topic in depth before you can actually advise a patient of what they should be doing. Sex hormone binding globulin, wonderful level, 53. So that's a cracking number. So this guy has got a raised HbA1c, which would give you the suspicion that he would have a low SHBG. He hasn't got an overactive thyroid. So this is actually a good, as we said, positive marker for health. Prolactin, normal. Now again, prolactin is a super reactive hormone, so we don't tend to overreact. Again, everything has to be taken in context. What's happening with this guy? This obviously guy has got healthy levels, so it's irrelevant. But, you know, is it come up because of the estradiol? Is he on medications? And if it's in its thousands, we need to be thinking about a tumour. Now, when we do look at these numbers and they're in their thousands, and you think, right, could it be a tumour? What would support that diagnosis? Now, obviously, taking a clinical history, any visual disturbance, headache, dizziness. But we tend to see a low LH and FSH if you've got an elevated prolactin and giving you the suspicion that it might be a tumour. It's a funny thing for a doctor to say, but if you're going to get a tumour, having a prolactinoma is probably one of the least harsh tumours to have. It's quite easily managed. Testosterone, 26.5. Get in. So actually a wonderful testosterone level. His free testosterone, you would argue perhaps is suboptimal, but actually it's good, nice and healthy testosterone, free testosterone of 0.433. So this guy is not a candidate for TRT. We also measure zinc. This is a funny one. The reference range for this is pretty rubbish. I mean, you tend to see levels that are on the high end of normal or just above normal. And again, everything has to be taken into context. The last test is the hematology, the full blood count. So what do we tend to see with this? Well, if they've been dehydrated, like this chap, you tend to see a raise in hematocrit. Now, he hasn't got a raise in hematocrit because he's otherwise healthy. We sometimes see a rise in hemoglobin and hematocrit. And again, you have to think, right, is this guy a snorer? So again, that would give you the suspicion that he might have obstructive sleep apnea. Again, the other things, obvious things that we'd know as a doctor, MCV problems, platelets, and these things have to be investigated if they are abnormal. Now, we have picked up severe anemias before, and this guy had cancer. He had a gastrointestinal cancer, stage 4 bowel cancer. So, having been previously dismissed by other doctors, due diligence, go and see your doctor and get this investigated. Do not accept this as a normal for you, because I can assure you it's not normal at all. So yeah, this guy was obviously incredibly grateful that we actually picked up this anemia, which then led to the diagnosis of bowel cancer, which then led to treatment, and he's now in remission. So the importance of screening. Hopefully you can see the importance now. It is incredibly important. So this guy was obviously given the information that we've just spoken about, and in summary, that's essentially addressing his diet to optimize his HbA1c, looking at vitamin D, again, diet to optimize his lipid profile, potentially think about a B complex to improve his folate and his B12, but they're reasonably within range. And then potentially looking at why his SHBG may be elevated. So again, this is a 10-minute diagnostic call. So we cover a lot of information in 10 minutes. And these guys are often incredibly grateful. And despite they don't need testosterone replacement therapy, they've been given pointers to improve other aspects of their life. And again, the symptoms of low testosterone, they're very vague, aren't they? So tiredness. Who's not tired every once in a while? Low libido. Who's not got a low libido every once in a while? Especially when you're stressed. You're not supposed to have a libido when you're stressed. So the list goes on. So you cannot underemphasize or overemphasize the importance of a comprehensive blood screen and consultation with a medical doctor who understands the numbers, physiology, understands the necessity to address lifestyle, nutrition, exercise, and adopt a holistic approach to health, and not rush into the diagnosis of testosterone deficiency. Because there are too many clinics out there saying, congratulations, you qualify for TRT. Now, if you need TRT, you will be prescribed TRT. But as I said before, we advocate the more comprehensive test to start off with. You don't have to, but again, you'll just see from this conversation that there's a lot of information can be gleaned from it. And then we suggest what you can do to optimize your health, to then have the confirmatory test in 4 to 6 weeks time, and then make a more considered decision about what you want to do to positively impact your health, and take personal responsibility, because ultimately it's down to you to do what? Yeah, you guessed it. Go earn your reward.